Okay, so in this video we are going to talk about the vascular test for the cervical spine, or in other words the clearing sign for the cervical spine. So we are going to, this is the continuation of my previous video. In this video we are going to talk about two tests. So vertebral artery test, or in other words cervical quadrant test, or the second is a static vertebral artery test. But before we go for that two tests, we'll talk a little bit about the factors you have to consider before even examining the vascular signs for the cervical test or a cervical spine. So what are the factors? So first of all, you have to consider the risk factors for the cervical spine. All those vascular risk factors, like if the patient has a hypertension, hyperlipidemia, or high cholesterol level, or a history of smoking, general clotting factors, diabetes mellitus, or any trauma to the vessel. The other factors you have to consider is cranial nerve examination. If the nystagmus is because of the cranial nerves, cognitive examination, headache, and blood pressure examination. Now, there are some of the ischemic signs that typically indicates that these ischemic signs are a vertebral artery ischemic sign. So what are that? So first, patient will complain about occipital headache like no other, ipsilateral upper cervical quadrant test. The signs of hindbrain TIA. TIA is transient ischemic attack. So these are again 5Ds and 3Ns. So 5Ds, it's like dizziness, drop attack, diplopia, dysphagia, and dysarthria. And 3Ns, it's like nystagmus, numbness, and nausea. The other other signs of the vertebral artery ischemia or infarction is a Wallenberg syndrome. So Wallenberg syndrome is the stroke that is caused by the infarction in the vertebral artery and pica, posterior inferior cerebral artery. So this all you check, and then you move to the testing for the vertebral artery test. So we'll start with the first test, that is the vertebral artery test, or in other words cervical quadrant test. So you have to perform this test with the patient is in a supine lying position. Take the head and neck into full extension, and then take the head and neck with extension and side flexion. So hold that position for 10 to 30 seconds. If the patient presents all that nystagmus, nausea, all the signs and symptoms of vertebral artery, that means the opposite side of the vertebral artery is affected. Now, there is something called as a Decline-Neuenhuis test. So what is that Decline-Neuenhuis test? So that means you consider the extension and rotation component rather than extension and side flexion component. So that means the Decline-Neuenhuis test is positive. Now we'll move to the second test, that is the static vertebral artery test. Now according to Grant, static vertebral artery test should be performed in two steps. So one, the patient is in a sitting position. The second is patient is in a supine lying position. So when you perform the test is in the sitting position, it goes with the provocative steps. So if you can produce the signs and symptoms in one test, do not go to the next test. So the first, take the head and neck into extension. If there are no symptoms, second, take the head and neck into extreme rotation. If the patient presents the signs and symptoms, that means the Barry-Lew sign is positive. Now, take the extension and rotation component together to check if the patient has a symptoms present. That means if the extension and rotation component presents the symptoms, that means decline test is positive. Now, after that, check the provocative movements. If there are no symptoms, go to the quick movements, quick provocative movements of the head. If still symptoms are not produced, go with the quick repeated head movements in the provocative test. Now you perform the same all test in a supine lying position. So first you go with the extension of the head and neck. If no symptoms are produced, you go with the rotation towards the right and left. Again, if the no symptoms are produced, combine the rotation and extension either to the left and right. If the symptoms are produced, that means the Hall-Pike maneuver is positive. So you have to consider that extension and rotation component checks the vertebral artery. Only the extension component checks the intervertebral foramen. Now, in the end of this video, I'll put a chart that will differentiate between the head position what are the vascular signs, vascular status, and the third is a neurological status. So you can check with flexion, extension, side flexion, extension and rotation, and side flexion and rotation. Thank you.